recognize the Chairperson Board of Governors, Dr. Rosemary Nasanga. Doctor, you're welcome. And Dr. Rosemary Nasanga is also the supervisor of this hospital. And she's also a urologist, and she has a clinic here. So if you have those cases, please bring them here. Doctor is available every what? Every Tuesday. Doctor is available. We also want to recognize the presence of our health inspector, Elias Waswa. You are welcome. We want also to recognize the presence of the area councillor, Christine Nadule. You are very welcome. Before us is Ms. Nakagwa, who is also standing in as the chairperson, LC1 Masanda. You are welcome. And she's our senior VHT, and she has a story to tell. She knows where this hospital started and where it is now. You are very welcome. I want to recognize all the members of Rotary Club Kampala Central. You are all very, very welcome. I recognize the medical director, Sister Dr. Sanini Sara. You are very welcome. I recognize all the staff present. Being a weekend, you won't see many of them, but at least a team is here. You are all very welcome. So briefly, Mother of Mass Hospital originally was called Banabikira Kyengera Women's Medical Center, but there was a public outcry. That's why that segregation, why that? So we listened, the board informed the registered trustees of Banabikira Sisters, the owners of this project, that at least we make it a general hospital treating all patients. And we therefore had to change the name from Banabikira Kyengera Women's Medical Center to Mother of Mass Hospital Kyengera. And this change, I had not seen Dr. Rogers. Dr. Rogers, you are very welcome. she's when I talk about this story, this is the go in between us and the other Rotarians, those of you who are here, but those in UK and world over in regard to this project. He's the liaison officer. Dr. Rogers, you are very welcome. So I was telling you there was a public outcry that this is a big facility. It cannot only serve women alone, but all people. And we changed from Banabikira Kyengera Women's Medical Center to Mother of Mass Hospital Kyengera. And therefore we are now serving all categories of people. Doctor will tell us those categories in his speech. So Mother of Mass Hospital was founded on the 4th of March, 2024. That was the first hospital day. And therefore, we already celebrated a year in existence and almost other 6 months. We have the bed capacity. Currently, it is 65, but in the future, we expect this to grow up to 150 beds, and the operational beds currently are 40. So today, we are here to commission and launch Mother of Mass Hospital Theatre. And this function is officiated over by Rotary Club Kampala Central on behalf of all Rotarians world over. Allow me to begin with this statement. I am because you are. Mother of Mass Hospital, the way it is today is because of you, dear Rotarians, and all well-wishers, and all you people of goodwill, people present and not present. Without you, I can't tell what kind of face that would be covering this place. The theater project is part of the entire Mercy Hospital project, which was originally funded by Marka Kilop Paul, rest in peace, an American philanthropist. It came to a standstill after his demise in 2018. And in 2019, the owners of this project, Banabikla Sisters, started again, but they were challenged by the outbreak of COVID-19, since most of the projects that were supporting the construction activities came to a standstill due to the lockdown by then. We all don't want to remember that time. The lockdown was really terrible. So it greatly affected the performance of this structure. We would have been somewhere far, but we had to backslide. So it was from this background that Rotary Club of Reading Martin's Charity UK was approached and picked up the project. It is important to note that the theatre project was divided into two, if not three, as I'm going to mention. So there was part of completing the construction works, there was part of equipping it, and there was also a part embedded in, because for us to have good staff, they need training, the vocational training teams. So there was the completing of construction of the theater facility, the completing of the private rooms, 4 rooms to be used by the vocational training teams when they come to train our staff. When they are not around, we use them as wards, private patients use them, and also the kitchen and the boardroom that those vocational training teams had to use. So, Rotary Club of Reading Martin's Charity UK contributed 89,243,728 shillings for the procurement of construction materials, while Banabikla Sisters provided for the labor, which was 31,076,260 shillings. Now, I talked about the VTTs, the vocational training teams. This is a program that we prepared even before the opening of the hospital. These people came from UK in 2023, and we did a community needs assessment. We sat at Health Center 3. We had a big number of people. Some of you are around. Mr. Elias was there. Nakagwa, Ms. Nakagwa was there. Councillor Nalule was there. And other people were also there. I was also part of, and others were there. So this May, this was the first time that these people came. They were 2, a team of 2. Gillian Peace and Claire Carter. They came to train our staff, mainly in obstetric skills and other skills. They trained also the VHTs in community hygiene. And this program is to run every year. It is going to be part of the global grant. The other time they came supporting themselves. The training covers the hospital staff here, but even all other staff, the medical staff, especially the midwives, from all the surrounding health units, which would be referring to us. We are looking forward to be declared a hospital, which means all the facilities around will be referring to us, the patients. So, in July 2024, the procurement of medical equipment was done. But the operationalization of the theater did not start there and then. Someone would wonder, because I'm going to mention the date when we had the first surgery. There was some setback, which was for our good. When the district team came to inspect, some things were wanting. So there had to be done some modifications. And therefore, right now, I want to recognize our engineer, Mulema Evarist. He's the one who helped us do all those required modifications. It was not easy because we had to spend more money. And on that note, Rotary Club UK sent us 31,076,206 shillings, while the owners, Banabikira Sisters, put in 35 million to complete those modifications to enable the theatre be opened up to the standard desired by the Ministry of Health. Actually, when you go there, you will see it, and you also appreciate it. So the procurement of the theatre